Here we go. Good evening, everyone. Welcome to CB7's Health and Human Services Committee. This is our first meeting of the new calendar year. Happy New Year to everyone. We are so happy to see folks and hope that everyone had a restorative and healthy holiday and that folks are kicking off the new year with good health and good spirits. So my name is Michelle Avila, and I'm the chair of the Health and Human Services Committee. I will read the agenda and put it up on the Zoom screen after I read the following guidelines. On December 21st of 2022, Mayor Adams issued Executive Order 291, extending the state of the emergency through January 20th, 2023. Accordingly, boards are able to continue to act under the state of emergency section of the video conferencing law, Chapter 56 of the laws of 2022, Part WW. This allows the board to continue remotely. Minutes and video recording will be made available on our website. If you are calling into the meeting on a conference line via Zoom, the controls are as follows. To hear all available commands, ** is on, we'll list all of the available commands. *6 mutes or unmutes, and *9 virtually raises your hand. How we will conduct this meeting is as follows. Bronx Community Board 7 has the right to remove and/or ask a member of the public to leave a meeting or block participation of anyone who engages in inappropriate conduct, including but not limited to obscene or offensive images or language, personal attacks, threats, or any other behavior that reasonably impedes the orderly administration of this meeting. Repeated offenses will be reviewed by the board's executive committee or any other assigned committee for a ban, the amount of which time would be objectively determined by the above committee of the participant in the event of repeated disruptive behavior. If in-person outbursts or attacks continue, this will be considered disturbing the peace and authorities shall be summoned. Additionally, everyone besides the speaker or presenter will stay muted throughout the meeting. After each presentation is over, I will inquire if committee members have questions. Committee members could signify that they have questions by pressing the raise hand button on the Zoom screen or requesting to speak through the chat or when the chair opens the floor. Members of the public who have joined through the online link will be able to ask questions and make a brief statement on the item after each presentation and after the committee has had an opportunity to ask clarifying questions, again by pressing the raise hand button on the screen or requesting to speak through the chat or when the chair opens the floor. Only those recognized by the chair of the committee will allow to speak during the allotted time. We will stay on topic with the agenda items. Any other items will be acknowledged by the chair in new business or addressed at the next meeting, granted that there is time and the committee agrees on the topic. Following the questions, discussion, and public comment portion, the committee will begin their discussion after each presentation and agenda item and will conclude with the decision to vote on a recommendation. When the agenda is finished, the meeting will be adjourned. If there are any other questions related to meeting software or to process, please use the chat function or raise hand function or contact our wonderful board staff. And so with that, I want to again welcome everyone. I'm going to pull up the agenda for tonight's meeting. I'm so glad to see so many faces. I know that we're going to hear from quite a few folks tonight. Can folks see my screen?
Yes.
Right.
Perfect.
Yeah,
Okay.
you got it. It's good.
Awesome. Thank you. So we will go through attendance and then we will review the previous minutes. There was no December meeting, so we don't have any minutes to approve. We will go into new business and we have representatives from DIFTA and Moya here tonight. I also saw Keisha and maybe Alfredo from North Central. Would love to invite y'all to share updates. As usual, we will leave time to hear from the public and from anyone that's attending to make any special announcements. And would love folks' thoughts on future agenda items for either next month or later on in the year. And so with that, I will quickly go into roll call. So Michelle Avila is here. Mr. Alfred Grant.
Yeah, I'm here.
Hi, Mr. Grant. Happy New Year.
Mhm.
Ms. Helene Wilson.
Yes, I'm here.
Hello. Emmanuel Atamoa.
Yeah, Emmanuel Samoa is here.
Hey,
Happy New Year.
Emmanuel. Happy New Year. Daisy Perry.
Hi, Happy New Year. Daisy Perry present.
Hey, Daisy, thank you. Chad Royer. Chad. Chad, when you get back on a device, just acknowledge that I called your name so I can note you down for attendance. And Taina Pena. Taina Pena. Okay, we have quorum. We do not have any voting items, but still really happy and pumped to have quorum tonight. And so we have a few members from DIFTA and Moya here with us tonight. Would love to hear some updates, so I'll call them shortly. But just as a general kind of state of where we are, folks know that unfortunately we are seeing an increase in rising rates of COVID. And so we need to do our best as a community to continue protecting ourselves, vaccinating ourselves, masking up, and doing so for ourselves and also for our elderly neighbors, those who have chronic illnesses and young folks. And so we will watch the COVID rates over the next couple of weeks. And if they start going up exponentially, we'll start doing the kind of mini numbers recap that we used to do in previous months. Just to advise the community on where we are with COVID rates. This is also cold and flu season, and there have been a couple of respiratory infections that have also been circulating. So really encourage folks to just practice good hygiene, washing hands, again, masks work for that as well. And I think either Keisha or Alfredo will probably kind of add something from the health, public health perspective. But again, we're fortunate to have 2 hospital systems in our district. And so really encouraging folks to stay on top of all of your health kind of appointments, whether that's regular checkups or going to places if we're not feeling well. And so with that, I will ask for the first agency listed in our agenda to please unmute themselves. I believe it's DIFTA, which is Department for the Aging. And hi, Josue. Yes, hi, Josue.
Hi, Michelle. How are you?
Good. Thanks so much for joining. We are super excited to hear from you tonight. And so if you could please introduce yourself, a little bit about what you do, and then share some updates for folks.
Not a problem. Thank you for having me tonight, and Happy New Year to everyone. My name is Josue Melendez. I'm the Bronx Government Affairs Officer for the New York City Department for the Aging. I was invited tonight just to give a couple of updates about the agency and what we've been up to, or some of the main campaigns that we've engaged in the past couple of months. And in addition to that, just sort of some of the services that we can provide and offer as an agency to older adults. So one of the first things I wanted to mention that you've probably seen on some of the buses or on the trains is our Join Us campaign. It's the most recent PSA campaign that we have launched. And the whole idea behind that is to get older adults back into the older adult centers. Our centers are really the hub where we're able to really connect people with a lot of the programs, services, and different kinds of resources that are available to older adults. So the way that we operate as an agency, for any of those who aren't aware, is we provide a couple of core services directly through us. So we have certain programs like Silver Stars, which is a financial assistance program. We do some health insurance guidance through our high cap program, but a lot of the direct services that older adults experience or that they require, like in-home assistance, home health aides, things like that, is usually arranged through older adult centers, through the providers that we contract them, that we work with at older adult centers. So we really encourage older adults to get out to the centers, to become members, and to be able to get access and connect with case managers and people who can really give them an idea of the array of services that are available to them. And kind of in addition to that, one of the things that we noticed over the course of the pandemic was really the need for social interaction amongst older adults. We created a couple of programs, just friendly voices and friendly visiting, as a way for people to connect virtually, to kind of keep them in touch and fight social isolation, which was a big problem that we noticed. So by having older adults get back into their centers, we're also part of that is we're trying to get them connected with people again. When we've talked to folks, at least me personally, when I've talked to some of the older adults in centers, one of the things that they highlighted and that they mentioned that they missed so much during the pandemic was just really being able to see people and have those friendships and kind of maintain them. So getting people back into the centers and re-engaging them in those friendships is also part of that, and part of what we consider kind of healthy living, in addition to getting access to the meals that they get, whether it's home delivered or just the actual lunches they receive. So that's the whole idea behind the Join Us campaign. The second thing that I wanted to mention, and it's one of the ways that we're trying to really work together collaboratively with other agencies, is we, back in September, launched the Older Adults Cabinet. So the idea behind that is it's a collection of 17 different city agencies working together to come up with different ways to address issues that are facing older adults specifically, and kind of to come up with ways to address them in a collaborative manner. So there's some things that we'll run into, just kind of to give you an example, housing is an issue that we're really running into a lot of times, where older adults are looking for housing. And we do recognize that there is a lack of new housing and it's not being built fast enough. So, one of the ideas behind this cabinet is we're able to work directly with agencies like HPD, with like NYCHA, Department of Buildings, and we can come up with creative solutions and ideas for how we can address housing issues currently and also plan for the future. And, we can get direct input. So that's the whole idea behind the cabinet, and we're very happy with the kind of work that they're starting to do, and that the ideas that they're really kind of starting to produce out there. Just to give you another idea of just some of the general services that we can offer through some of the centers, as I mentioned, we connect people to in-home assistance, home health aides. We have people who can come and assist with basic cleaning services, cooking, people who need assistance with bathing. We're able to connect them with services such as that. There's also financial assistance in the form of financial counseling. We'll have people who can come and sit down with older adults and have them go over their finances, find ways that they can help save and get them involved with public programs, SNAP. If they're not currently receiving any kind of public benefits, we connect them and we explain how they can get access to those kinds of benefits. Just little ways to encourage them to save, and also to take full advantage of what's available to them through the city itself. So that's just kind of a general idea of some of the programs and services that we can offer through our older adult centers, and just some of the what we've been trying to do and move forward as an agency. If anyone has any questions, I'm more than happy to answer to the best of my ability. The one thing that I wasn't able to, fortunately, to pull up, I know you hadn't requested, was just a list of some of the specific centers in your district. I have it sorted by the entire Bronx, but I don't have it by specific community board. So I'll try to send you that tomorrow so that we can give it to the rest of the board and just give you an idea of what providers we have available in the community.
Thanks, Josue. That's really helpful. We really appreciate this update. We have had a couple of folks from the community come over the last couple of months, really worried about seniors in our community, just like post-COVID. To your point, connecting seniors back to the resources that are available. We've heard about food needs for seniors. We've heard about scams that are particularly affecting our senior community. So it's just great to have you provide this update, and we hope that you will continue to come and keep us apprised of all new initiatives. Before I turn it over to my colleagues on the committee and to other board members and members of the public, I wanted to ask, for the older adults CAB that you have, are there also like members, older adults that are members giving in their input?
I do believe that there's input from older adults specifically. I would have to ask the people who are representing DIFTA specifically on that group to know for sure. But I do know that the idea was getting agencies to come together to kind of tackle some of the issues that we've encountered as an agency when it comes to working with older adult issues, and also kind of speak to them about what issues they've encountered. But I can get more specifics on the actual input that they're receiving from maybe outside of those agencies.
That would be great, Josue. And if there's like an open process where we could get some of our seniors, like invite them to join, we'd love to share that as well. We have really, really active seniors in our community. They're the bedrock of, I know CB7 and a lot of different community groups. So if that's an opportunity that's available, we'd love to share it.
Of course.
Awesome. So I see my colleague Chad has his hand up. Chad, go ahead and unmute yourself.
Yes, hi, good evening. First off, can you hear me while I'm outside?
Yes, I can.
Okay, so hello, everyone. Thank you for sharing that information. I wanted to find out two things. One, does your program provide a gateway where our older folks can get health bucks, where they could use in the fresh markets?
So during the summer, we receive a certain amount of health bucks from the state government and through the state health department. I believe it's the person who provides it. And through after we receive them, we provide them to older adult centers who then disseminate them throughout the community. So I know a lot of times like council members will get them and certain other organizations. So we're one of those groups that gets a certain amount of them. And then we just disseminate them to the community through our older adult centers. So through, I think it's about August, they start getting sent out. So people will reach out to us or reach out to the centers. They'll take their information down. And then once the actual bucks themselves arrive, then they'll start giving them out to their members and or pretty much any older adult who shows up requesting them.
Okay, thank you. And the other question I wanted to ask, does your agency help with putting together NORC programs,
NORC?
naturally occurring retirement communities?
Yes, so we do oversee and work with NORCs. I think the specific process for applying to be a NORC, I think it requires like an RFP to go out, and then people would have to apply with usually with a provider to create a NORC. But yes, if you if you are interested in forming a NORC or working to create a NORC, you would reach out to our agency, and then we could connect you with people who work specifically or oversee NORCs or older adult centers.
Okay, thanks. Thank you.
Of course.
Thanks, Chad. Committee Health and Human Services Committee members, anyone else have questions for Josue? Any Community Board 7 members have questions for Josue? Members of the public, AJ, I see your hand up. Please go ahead and ask your question.
Hello, can you hear me?
Yes.
Yeah, I know it's been some time since CB7 met at the offices, but Sister Nunciata Bethel Senior Center is literally right next door to you guys.
Yeah.
I'm pretty sure we have some other ones, but let's not forget your neighbors.
Absolutely. Absolutely. Thanks, AJ. And yeah, I think that's a really good reminder. And this is why we asked Josue also to pull the list of senior centers, because it would be good to share that with the entire board. And maybe we can have something printed in the office now that the office is reopening again, so that our neighbors can come by and see what's available and what services are available.
No, for sure. I can we have a trifold brochure that I can send to a PDF copy of. And what it is it's usually what I'll take to presentations or to just to tabling events. And it basically has a small description of every single program that we run through our older adult centers. So it's an easy way for people to kind of get an idea of what we do and how we're able to provide those kinds of services. So I can also get that to you along with, as I said, kind of a list of the different centers and providers that operate within Community Board 7.
Awesome. Thank you so much. That would be great. Again, just one more chance for any questions, comments for Josue. All right, if nothing else, thank you so much, Josue, for joining us. We invite you to stay for the rest of the meeting, but of course, if you need to go, completely understand, and we really hope that you'll come back again. So thank you.
Thank you for having me.
I want to ask if anyone from the Department of Health and Mental Hygiene is on the line. Department of Health and Mental Hygiene. Okay. I'm going to move to our next city agency, the Mayor's Office for Immigrant Affairs, or MOIA. I see Lewis on the line. Hi, Lewis.
Hello, Happy New Year.
Happy New Year. How are you?
I'm good, thank you. Yourself?
Good, good. So happy to see y'all. Again, we've been really, over the last couple of months, hearing from board members and residents, just a lot of questions about what's happening with migrants, services for immigrants. We have a really large immigrant population in CV7, really diverse and vibrant. So we're super excited to have you here tonight, and hope that you'll share some great updates so that we can pass forward to the community. So please go ahead.
Okay, well, thank you. And again, Happy New Year to everyone. As was mentioned, my name is Louis Gourier. I'm one of the program coordinators at the Mayor's Office of Immigrant Affairs, and I'll just be providing an update on the navigation centers. All right, so as I'm sure you're aware, the navigation centers were set up by the city as a one-stop shop for asylum seekers to go and receive a variety of services and resources that they need. So as an update, walk-ins are now being welcomed at the navigation centers on a first come, first served basis. We begin seeing clients at 9 a.m. and we finish at 5 p.m., but we encourage everyone to try to be there the latest by 3:30. Also, the city has also opened 10 satellite sites, satellite navigation centers throughout the city, where asylum seekers can also walk in to receive services there as well. For a list of all the satellite sites in the city, you can just go onto the Moya website, or you can just Google NYC Asylum Seeker Response. NYC Asylum Seeker Response, and you'll be able to see a list of all the satellite centers in the 5 boroughs. Yeah, so I think that's pretty much it. And if anyone has any questions or would like to contact me directly, let me give you my cell phone number. So it's 646-457-8691. Or you can also shoot us an email at our Ask Moya email, which is askmoya.cityhall.nyc.gov. Okay. All right. So I think that's pretty much it.
Thanks so much,
No problem.
Louis. I'm trying to put in that website in the chat. We
Mhm.
love to share for all participants here. We'll record your number in the minutes and be sure to reach out with any questions as well.
Right.
I do want to ask any committee members if they have questions for Louis. I actually had a question, Louis.
Sure,
At the
sure.
navigation centers and
Mhm.
satellite centers, could you just please explain like what services, like from intake to kind of till they exit their appointment, like what services are they being connected to? What are you all seeing, just to give the committee a sense of that?
Well, the main center, which is located in Manhattan at 520 West 49th Street at the American Red Cross Center, that is really where the bulk of the services and resources are. There are several city agencies that are represented there. So asylum seekers can go and receive healthcare services, for example, health insurance enrollment, mental health counseling, school enrollment for their children, food and clothing assistance if they need that. There's also legal consultations, orientations, I should say, if they also need that. There's also job readiness programs there available as well. But for the satellite centers, not every city agency is represented there. So their services are kind of unique. For example, in Staten Island, we have La Comena, and their service really is focusing on workforce development. In Queens, we have NICE, the New Immigrant Community Empowerment. They're focusing also on workforce development. So what do we have there? Yeah, there are some centers in Manhattan and also the Bronx. Let me see if I can find the names of those. 1 second.
Thank you.
Okay. And if I can't find them, I'll provide that to you later.
Absolutely.
Yeah. So let's see. Um, Okay, yeah. So in Manhattan, we have Aid for AIDS International. They're focusing on information referrals and direct assistance. Coalición Mexicana, also information referrals and direct assistance. We have African Communities Together, and they're focusing on immigrant rights workshops. I don't see any in the Bronx, but in Brooklyn, there's also a Coalición Mexicana and Mixteca organization. And their focus is also information referrals and direct assistance. But I'll double check to see if there are satellite centers in the Bronx. I believe there are, and I'll get back to you.
Thanks. That's very helpful, Louis.
No problem.
I want to invite committee members, anyone with questions for Louis? Members of Community Board 7, anyone with questions? Members of the public, any questions for Louis? Awesome. Thanks so much, Liz. I think that between the navigation page and the information that you shared, we should have enough information. We'll absolutely reach out to you with any other questions and would definitely appreciate the name of the Bronx Center if they're available.
Absolutely. I'll get back with you with that information tomorrow.
Awesome. Thank you so much. Thanks for
You're
joining
welcome.
us.
No problem.
Awesome. So moving our agenda right along, I will ask our hospitals. So I'm going to ask North Central if they have updates. I see Alfredo and Keisha on. Hi, Alfredo.
Hey, Michelle. Happy New Year, everyone.
Happy New Year.
Glad to be back. Hope everyone is well. There isn't a lot other than we're really happy that we're going to be upgrading our mammography unit in North Central. So we've been currently running on a 2-dimensional platform, and we're upgrading to a 3-dimensional platform by the end of the month, and hope to be operational by February 1st. This is big for, and I would say Community Board 7 has been really a great partner and advocate. We always do a huge October push to do free mammography screenings. We beefed up that department, so we're actually hoping that we have more availability on Saturdays for the entire year. And that's like a huge push that we've been trying to get to. Staffing has been of a concern, but we're in a better place now in 2023. And with the device coming in for the 23rd of January, we're hoping there's a full formal launch on the 1st of February. Besides that, the hospital just continues to absorb. As mentioned, yes, we have been seeing both COVID, influenza, RSV. The emergency department has been absorbing a little more than usual. They had a little bit of a dip in 2022, and it has picked up for the fourth quarter of 2022 right into this first quarter. And I believe that is going to become our new norm. That goes for both pediatrics and adults. We're seeing it on all ages. Albeit, if you were to look at some of the trackers, it almost seems as though the positivity rate has dropped. I would be very cautious of taking that as a true definition of what's happening. Much like how we say in our facility on a daily basis, please keep your mask on. I would tell folks, don't get caught off guard. This seems to be highly transmissible, this current variant that we don't know too much about, but we're starting to learn about. And just be careful. Please, please be careful. All hospitals are full with folks who are dealing with either COVID or influenza or this respiratory virus. And that's it so far. Keisha, did I miss anything?
That was excellent, Alfredo. Thank you.
Appreciate you. Thank you.
Thanks so much, Alfredo and Keisha. You all are fantastic partners, and we know how hard you and everyone at North Central works to really meet the needs. In times of crisis and high rates of COVID, y'all definitely step up. So we appreciate you. I do want to ask if anyone on the committee has any questions for Alfredo. Anyone from the community board? Any members of the community board questions? Okay, and members of the public, any questions for Alfredo? Awesome. We are breezing through tonight. Thanks, Alfredo. Thank you, Keisha. And you all are always in touch, so we will absolutely continue the dialogue. But great to hear that you have this new machine, well, this new technology, I should say. And yeah, we look forward to continuing being partners for that push at the end of the year.
Thanks,
Thank you
Michelle.
so much.
And Happy New Year, Michelle. Thank you.
Happy New Year. I want to ask if anyone from Montefiore is on. So we did reach out to Montefiore earlier this year as we all kind of saw the public news about the nurse strike that was occurring at Montefiore and I believe at Mount Sinai as well. Unfortunately, the government relations rep, Jade, is unable to join us tonight because they have a community advisory board meeting. However, she did forward this webpage that I'm putting in the chat, which outlines that the Montefiore and the NISNA nurses did come to an agreement on January 12th. I know there were several days of strikes and we were concerned on how that was impacting patients and patient care. It does seem that this agreement is beneficial, and so I'll just read out some highlights that are included in the webpage that I just put in the chat. So they still have to vote to ratify this, but this is what everyone has come to terms with. So the new agreement includes a 19.1 wage increases for NISNA nurses, an increase of over 170 new nursing positions, maintains fully funded healthcare for eligible nurses and lifetime health coverage for eligible retired nurses. It includes an increase in preceptor and charge nurse pay of $5 per hour over standard wages. It increases the float pool nurses, adding significantly more registered nurses and nurse practitioners in the emergency departments, mirroring inpatient unit staffing obligations, and continues to significantly increase nurse education infrastructure in the emergency departments. So you can read the full statement on that webpage. I will also ask our board staff to circulate this to the entire board, as I know that a few board members had reached out to me, had reached out to Carla and me asking if we had any updates from Montefiore. So any questions or comments to this news? Hi, Chad. Go ahead. Chad, we can't hear you. So if you need to unmute yourself.
Sorry, that's why you couldn't hear me. I had the train pass.
Oh, it's
I was just wondering if there was any concrete info on an agreed upon nurse to patient ratio that ever came up from the negotiation. I'm not sure if that was published or disclosed or referenced.
Sure, Chad. I think what is public is what they have on the website. My scan, I don't see any specific numbers outside of an increase of for float pool nurses, for the ED departments mirroring inpatient unit staffing obligations. So I don't see any hard numbers, but there is mention of that in the statement that Montefiore put out.
Okay, because I remember when there was an interview done by one of the nurses leading the front line of the strike on Channel 5, it was mentioned that that question was asked to be brought to the table, and I would be curious to know if there'll ever be a hard number that nurses will feel comfortable around. Hopefully.
Thanks, Chad. I definitely can note your question and
Yeah.
and ask Montefiore if they have that information and would be willing to provide it publicly. So I can ask. Absolutely.
Okay, thanks.
No problem. AJ, I see your hand is up. Feel free to unmute yourself.
Yes, hello. I wanted to see if the board could follow up on the nurses that actually presented to the board a couple months before the strike to see how they feel or if the conditions have bettered post-deal or post-strike. Thank you.
Thanks, AJ. Gotcha. We'll also do a follow-up there. We did, and thank you for reminding us that we did make a public statement in support of our nurses maybe close to a year ago as negotiations were starting. So we will absolutely follow up. Okay.
Hello. Can you see? I thought my hand was raised.
Oh, hi, Alfred. No, your hand wasn't raised. Go ahead.
Yeah, I just want to make sure that because of the strike, there was two things that I noticed that they had on their agenda. One was staffing, and the second, they say, was salary. I think they both intertwined because of the COVID era. Nurses have seem to have left the city, period, have also left North Central. But because Montefiore has the ability that they can go on strike, we city can't go because of Taylor law. And the thing is the thing that has always come to our health committee for years was the nurses. The majority of them from the emergency room, a shortage of staff. Now, I noticed upon looking at it on the television, the administration of Monty was acting like they were holding out, but I believe that this, I guess they came to an end that they will staff the nursing and give more salary, but I believe that this will be an ongoing thing because of during the era of COVID and respiratory problems and people leaving the city and migration has hit New York. That means hospitals will be filling up with individuals who have no real health coverage, but they will be fitting into the city hospitals and coming to emergency rooms. So I think this is an ongoing battle, and they just got a little reprieve from this so-called, because it hasn't been ratified yet. So.
Yeah, they have to vote to ratify it. Thank you, Alfred. Yeah, I mean, I think you're right that staffing ratios and salaries were really at the forefront of all of the negotiation talks. The statement that they sent over and that they have publicly available says that there's going to be a 19.1% wage increase, which is significant. And I think to Chad's point, you know, we don't know how the staffing ratio was addressed. We just know that they made a vague mention of it. So we'll definitely do our follow-up and ask if we can have that public, and also you know, see if we can contact some of the ED nurses that came to us earlier last year and also get their take on it. But I think you're right. I think that the healthcare landscape is going through a massive shift, especially after COVID. And so unfortunately, I don't think this is the last we're going to hear of these things. Thank you for your points and your comments. Anyone else? Okay, awesome. So we are done with the standing items on our agenda. I do want to invite a speaker that requested to speak tonight, Makai Palmer, who wants to talk about Maurice Park SDA Church. And if I mispronounce your name, please correct me so that we can be mindful and know for the future. But please go ahead and unmute yourself, and thank you so much for joining us.
Yes, thanks for inviting me. When I saw the subject, health and human services, I thought I might see 1,000 churches here, but quite clearly the memo didn't reach them. But anyhow, I've done a lot of research. I'm sure I'm probably preaching to the choir, but the Bronx has been ranked number 62 out of all 62 counties of New York State in health factors for the past 13 years consecutive. And as for me and my household, we want to do what we can to try and improve the overall health of our neighbors. According to statistics, there's so much poor health in our neighborhood. But anyhow, as a remedy, as an offer, we're introducing a free fitness club. I did prepare a 3.5-minute video. I don't know if I'll be able to air that.
Sure, we can, let me see. I'm gonna let you share and we can try it. And if not, you can email it over and we will share it with the committee and with the board. So just give me 1 second. Okay, you should be able to share now.
Okay, awesome.
And don't forget to click share sound as well so that we can hear the audio piece of it.
Okay. So, I don't believe anyone here speaks Spanish, but there are Spanish subtitles in case.
Thank you.
Mhm. It's not allowing me to share video. Let me try to share my screen. Sorry for the hold up there.
No worries, no worries.
I wonder if I click that button that you just reminded me to press.
Yeah, the
15
share.
consecutive years,
Can it be
the
heard?
Bronx has ranked number 62 out of all 62 counties of New York State in overall health factors according to countyhealthrankings.org. In other words, our neighbors are the most likely to have a premature death that's preventable statewide. But I say no more. I will rescue my neighbors from premature death as that lowly Galilean, that gentle healer did over 1900 years ago. My name is Makaja, and I am a certified community health advocate trainer. In 2011, in Norbury, which is in Southwest London, I hired my first ever personal trainer. While we improved my fitness, I learned the importance of active stretches and warm-ups, static stretches to reduce lactic acid buildup and soreness. I learned of superfoods and hydration, isometric and cardio and what each accomplishes, and I'll be sharing all that I learned with you. Introducing the Morris Park Seventh-day Adventist Church Fitness Club. All are welcome to join, however, Bronx, Manhattan, and Westchester County residents can join free. The workouts will be geared towards those who are at beginner to intermediate level of fitness. We'll be using high-intensity interval training, which is scientifically proven to be the best form of exercise in the market. All equipment will be supplied. Classes will be led by a trainer with 12 plus years experience in fitness, all in a judgment-free zone. Hint, it's yours truly. The club will be held at our full-size, purpose-built gymnasium at 800 Morris Park Avenue, close to public transportation. Classes will commence on January 29th, 2023, so mark your calendars. 7:30 a.m. daily, with Saturdays as our rest day, and Sundays you can join us from home or from your living room via our YouTube live stream. Here's why you want to be there. I might even say why you need to be there. First, you get the chance of a lifetime to join a group of like-minded individuals and socialize in a healthy, judgment-free zone. Furthermore, we'll be giving away prizes for reaching milestones in our 10-week challenge. Also, best of all, if you ask me, you'll be conditioning your body to serve the community, your loved ones, and neighbors better, Because if you're ever called to sprint a quarter mile to save a life, or to climb 6 flights of steps to rescue someone, you'll be ready. So I ask, will you accept this challenge to transform your life? Or will you let excuses keep you from having a new start in 2023? Don't miss the opportunity of a lifetime, because this may be the last time you hear this message. If you won't do it for yourself, do it for those that want you to live a vibrant, happy, and healthy life. Do it for those that are counting on you. So if you decided to take this challenge, register now at the link right here. The perfect complement to your decision to transform your life, to get the new life, and to have a new start in 2023 is Healthy Self, a beautifully illustrated 10-week guide following 10 principles that are scientifically proven to reverse chronic conditions, shed excess weight, and so much more. These will be available for sale in person at our club location, but if you want one sooner, go ahead and visit that link right here. Be there or be square.
Thank you so much.
Yes, indeed. And I'm sure the call to action is, well, what does that mean for us? Well, I'm asking for all of you who are able to effective influence, or those in your circle of influence, let them know that we are offering this because we recognize that the Bronx definitely doesn't have the income to be able to pay a personal trainer $100 per session. So we are soliciting your help in any way that you can. If you have any questions, present in the chat here with us is our Health Ministries Director, Ms. Maxine Willock. I don't know if she wants to just say anything to add, but yeah, anything that you can do to help, primarily promotion, letting the folks know what we're doing, and yeah, just keeping in touch with us as we continue to put things out like this. We have a pantry program feeding, countless amount of families every Sunday and Thursday. But yeah, that's all for me. Thank you for listening. I'll share the.
Thank you so much. I just put the flyers in the chat. We got them over email, and we'll also include them in our e-blast this week. So we will absolutely share out with the community. It's wonderful that you all are providing fitness services at a free cost. We definitely much needed. Miss Maxine, did you want to add anything?
Yes. Last year we had a health fair, bringing awareness to the community. Want to help them improve their health. It was a rain day, so but we still had a good turnout of almost 100 people showed up on a rain date. Could you imagine if it wasn't a rain date? This year we are targeting August 6th for our next health fair. So it's not just fitness we want to bring awareness to. We want their health to also improve, which we've started, and a lot of health started with myself. I've improved. That's why I became a medical missionary and get into this 9 different ailments, which I have overcame, which doctors at Montefiore just impressed by the progress I've made, taking brain MRI and seeing how my brain is clean from having blood splatter and tumor in my brain. So, learning how to walk again, and they was just impressed. So I felt compelled that if I can use the same food that I eat in the wrong way to correct the way for eating those same food in more of a raw diet, and a more healthy form, eliminating meats and things that will clog your arteries, that they can do the same and improve their health. Since I've done that, I've not gotten sick. I've not got COVID, and trust me, at times I've been exposed. A family member who's sick, I took care of them, and I've not gotten COVID. Every sickness and disease that's within my body I'd left. So I want to do the same for the community to help them, educate them. We have been approved some classes that will be going for, like we're going to be doing a massage courses, which Brother Palmer would be helping out with that. Him and his wife, they're certified massage therapists. We're going to be offering that to the community as well, with ways to learn how to do fresh juices to help themselves, the people who come to the soup, the pantry, to show them how to use the food in the right way to help improve their health, their BMI, and get better results to decrease of high blood pressure, diabetes. So we're using natural way of eating to help the community improve their health and hopefully turn the Bronx back into a blue zone. California, Loma Linda, they have a blue zone there. Why can't we? This is the poorest community and the worst health in the city, and it doesn't have to stay that way.
Thank you, Ms. Maxine. Agree. And I think that that is why my fellow committee members, board members, and members of the public are here tonight. It's something that we're all very passionate about, and big kudos to you and folks at your organization for coming together to do this. Please send us any flyers, anything that you have to promote the programs and activities that you all have going on, and we will absolutely send them out and share them with community members.
Thanks for.
Thank you. Thank you. Does anyone have any questions for Maxine or Mr. Palmer? Awesome. Wonderful. Thank you both again for attending tonight and sharing this great resource with us.
Thanks for having us.
Thank you. And thank you, Carla. Also put her email in the chat. Please send any flyers, any information, and they'll make sure, our board staff will make sure that they get it in our e-blast. So thank you. Sorry, go ahead.
No, I was just saying thank you for inviting us. Thank you.
Thanks so much. We have covered all of the new business on our agenda. I do want to ask if any committee member has any idea, suggestion, anything that they want to bring to the committee at this time for future presentations, future ideas. Hi, Chad, I see your hand. Go ahead.
Yes, so I really think we need to make a decision on what we're going to do to address the rat problems in our city. I know that we have the Rat Academy that shows up every month, and some of us attend, but then there's a lot more folks like the landlords and the supers who would be at the greatest advantage of showing up. So I'm just wondering if we could do something like maybe have a future joint meeting or a separate meeting where we have this subject as the main item for discussion, and then we get some kind of engagement with the members of the public, and maybe even a promise to cooperate, if that makes any sense on that matter.
Yeah, Chad, thanks so much for bringing this up. We, so yes, we do need to think about how we're going to address the rat problem as a board, because this doesn't only affect the Health and Human Services Committee. This affects other committees. We did have some outreach for to sponsor a Rat Academy training. And so I'm actually in discussion with Betty, who's the chair of sanitation, of the sanitation committee, to see if we can do a joint session and invite all of our committee members, board members, and members of the public to attend that. I think this is definitely something that we should also bring up at our executive committee meeting this Thursday. So Chad, if you or I'm happy to email Carla to get this on the agenda, but I do think that we need to think about how we streamline the conversations, because it is a big point of frustration for many community members.
And also, in the process of doing so, we might need to do a campaign blitz where we target folks that we want to show. Like in this case, I mentioned the supers, the superintendents, the tenant associations, so that they can have some autonomy on the way they handle the problem in their buildings.
I think that's a really good idea, Chad.
Yeah, and it'll be difficult. It'll be very difficult because of the language barrier and the timing, and some of the supers don't live in the building, but it deserves a discussion at the very least.
Yep.
Well, question, a little sarcasm, Chad. Did you see last week when the mayor of New York City got tickets for rats, and he had just cleaned up in front of his brownstone in Brooklyn? But it's
I read about that.
Major.
I read about that.
It's a major infestation throughout the whole city. It's not, they practically run the subway system. So there has to be something that is really, really major, because if you chase rats out of one place, they will hibernate in another. So this is something that has really overcome New York City, as well as they look like they're their own immigrants who come here to invade New York.
Yeah, and AJIC is also putting in the chat some information about the city recruiting a director of rodent mitigation. This is a citywide problem. We know that, and I think that there's short-term things that we need to do as a board. I think Chad is right, just maybe making people more aware of the Rat Academy trainings and encouraging more participation, but the city definitely has to step up and also do some enforcement and work with buildings, landlords, homeowners. This is not a one person or one office job. So points well taken. And Chad, I think we should absolutely bring this to Thursday's meeting. I see, I'm going to ask any other committee members if they have any topics, ideas for things to put on the agenda in the upcoming months. Okay, I'm going to send out a survey in the before the end of January, just to see if by topic, what folks want to hear more about. Again, I know we always have our hospitals on the agenda and our city agencies. Really happy that both Moya and DIFTA were here today, as that has also come up in the past. But if there are any ideas or anything else, any topics that are timely, please email me, and we can absolutely try to get a presenter for a topic just to get some more information. Any members of Community Board 7 or members of the community that would like to put out topics? And AJ, I do see your hand up, so go ahead and unmute yourself.
Yes, if you could just include the Rat Czar posting in like the community board emails of like local hirings, that would be a great job for one of our residents to have. And we need them. Thank you.
Yeah, that's a great idea. Thank you. Carla, did you get that?
Yes, I got it. Thank you.
Thank you. Awesome. Thank you so much. Anyone else? Any thoughts, suggestions, comments? All right, folks, we have been very efficient today and have gotten through. Oh, John, I see your hand up. Go ahead, John.
Hey, how you doing? Just a couple topics. Obviously, I have being that we are partnered with the Department of Health and Mental Hygiene and have been working diligently in the community, creating a health equity plan around a lot of the social determinants affecting the community. We haven't gotten the local political support that we would like, but we're still making waves in the community, which I'm very proud of. We just recently had a job fair on January 11th, where we serviced over 258 people in the community. The numbers haven't fully come in yet, but what I do know is the day of, we've gotten 12 people hired that didn't have jobs before, and the numbers are still coming in. So by this Thursday, we'll actually have an exact number. We're also having another job fair, which will be held April 26th. Still details still pending, but if you could put that on this for future engagement. Also, there's food insecurity is our number one priority and topic inside of the community. Something that we at Reserve would like to do is possibly create, or get some political support around creating a community garden for those who can't afford even the farmers market. Somehow, some way, we can get people in these communities some free food, and healthy food. Right, being that the Bronx is one of the most uh, food desert locations in the nation, not just New York City. So that's something that we would like to push and promote and create in the next upcoming months. So that's just something we want to put on the table, uh, because those are our biggest needs within our zip codes that we are servicing and within the Bronx as a whole. But just something we would like to address and get the ball rolling on, and we could use some support behind that thinking.
John, that's really helpful. Thank you. I'm curious, the survey that you all did put out the survey already. Am I getting that right?
Yeah, the survey for the job fair, right? So we serviced over again over 250 people, and just we need to get back the exact numbers of how many people are actually been hired,
Mhm.
and how many people have been spoken to and given a legitimate shot at a job, right? How many have been interviewed and things like that, because we are creating a future event. It's very successful, this event that we just had, and we're hoping to build upon that success. So when we do have the next one in April, we'll actually know how to proceed, and actually what other organizations that we can bring to the table as well. We've had a bunch of reputable organizations represented um, at the job fair, and we feel like we can make it larger. And being that jobs is a need, the number two need on our list, um, amongst seniors as well as other folks. DIFTA was actually a part of our job fair as well. So we want to continue to bring opportunity to the neighborhood. So, this was a again, a huge success, and we want to build upon that, and continue to hit our social determinants hard, and try to make change. So,
Thanks so much, John. Yeah, I have a few ideas coming up for me. Maybe we can schedule a call offline and think of how we can collaborate to get some of that support that you're talking about for things like community gardens. So thanks for sharing all of these topics. I think, yeah, there's a lot to do here. We've had presentations on social determinants of health, so the committee is familiar, but I think it would be great to start making some traction and supporting organizations and initiatives that are really looking to move the needle there. So thank you.
thank you.
Awesome. I know that Keisha from North Central Bronx is also sharing a few files in the chat. So there is, seems like there's a Facebook Live on ambulatory care that's on Wednesday, which is tomorrow, January 18th at 11 o'clock. You can join that via Facebook Live. Keisha, anything else that you'd want to promote?
Yes,
at
I
NCB?
yes, thanks, Michelle. I also shared a flyer. Every Friday we host job fairs at NCB, so the flyer is in the chat for everyone's view. Thank you so much.
All right, folks. Anything else? Comments, questions, concerns, ideas? Okay, there's nothing else. Do I have a motion to adjourn?
Motion to adjourn.
Is there a second?
I second that
Thank
motion.
you. Committee members, everyone say aye if you're in support of adjourning.
Aye.
Thank you. Thank you so much, everyone. Have a great night. Stay healthy. Thank you.
Good night, everyone.